Hi everybody, welcome back. Let's follow up in regards to what we were talking about before as we were going over like simple cases. Again, welcome to my channel, The Uplifting Psych MP. I'm Mia. Let's jump right back in. So let's talk about treating bipolar disorder. A patient who's 32 years old and a female with a history of mania and depressive episodes comes to you. There's no other history of any other medical health concerns that are reported, no history of ever being on any other meds in the past for psychiatric use. What would your decision be if you could think about it? Like, what is some things that you want to consider, you want to factor in? This person is very much has a primary care provider, very adherent to the medications, very much willingness to go for lab work as much as needed, as requested. What are you thinking about? You might want to look at, like I said in the last video, lithium. Lithium might be a great option, might not be, if she can tolerate the monitoring. If not, if she cannot tolerate the monitoring, you want to consider Lamictal for bipolar depression or Depakote for mood stabilization. Depakote, you still have to have some monitoring, but not to the degree of lithium. The slightest movement to one side or another can make it not therapeutic or toxic. So that's a big key factor. And again, lithium requires regular blood draws. So when a patient is having symptoms associated with bipolar disorder, you want to avoid introducing antidepressant as just that one pill monotherapy. It's okay to add it as an adjunct medication with a mood stabilizer or what have you, but just adding it by itself when the person is in mania or has a history of mania might actually throw them into mania and amass those manic or hypomanic features. If you're not sure of like how often that you should monitor and what you should be monitoring, you can use guides such as UpToDate that has all the latest information. They have Hippocrates. Again, like usually I look in this book and just kind of look through and see what labs might be needed and how often. Let's go over case number 4, treating psychosis in a young male. Patient is a 22-year-old male presenting with his first episode of psychosis. He's having paranoid delusions and poor insight. So when you hear all those things, he's a young male. He is experiencing psychosis. He's paranoid. He's having delusions. Delusions could be, fixed beliefs associated with something, and it's very hard. Paranoid that someone's after him because he is famous or whatever. Grandiose thinking process. We'll get into all that stuff at another time, but I guess an ideal would be to start with an atypical antipsychotic like Abilify. The reason why you might choose that, let's say he's overweight already, you want to take into consideration, let me just back up, you want to take into consideration the member's medical history. If they have a history of diabetes, if they have a history of being overweight, high cholesterol, all that stuff. These medications, there's pros and cons. Sometimes the benefits outweigh the risk and sometimes it doesn't. So you need to know, like, you want to treat the patient, but you want to do it in the safest way possible where you're trying your best not to increase any other medical concerns they may have. Is it always easy to accomplish that? Not at all. But if you can minimize it, that would be ideal. So with Abilify, it has a lower risk of metabolic issues, so increasing the risk for diabetes, increasing the risk of being overweight, and increasing, obviously there is still risk there, but not to the degree with some other people. I mean, with some other medications, not people. Sorry about that. Big thing with atypical and typical antipsychotics. No matter what, you want to monitor for something called EPS, extrapyramidal symptoms. They're medical and also metabolic changes and adherence. Family education is crucial. Encourage psychoeducation to improve adherence. So I always tell my members, hey, like, I'm starting you on this medication. These are the side effects. This is the risk versus the benefits. You might not notice anything initially, and that's okay within the first week, but let your family know what you're on and what to expect as well, so that they can also monitor. Because sometimes you as a patient, you don't really notice anything that might be a slight difference. For instance, you might have a little tremor that you're not even aware of, and you can't hold your fork or something like that. You might be experiencing extrapyramidal symptoms, or you may be less irritable, and you might not feel that way, but your family might say, hey, usually when you have to do this, I tell you to take out the garbage or something, you get so pissed off, and you're not doing that. You just get up and go and do whatever you got to do. Those are simple things that might help you. And it's also good to tell them to document down what your side effects are. Document how you felt the first day. How is it going throughout the time that you're on the medication? What's some concerns that you have? What's some things that you've noticed that are good? And also have input of the family as well. Case number 5. Let's talk about ADHD treatment in an adult student. So we have a 30-year-old graduate student struggling with focus and time management. He doesn't have a history of substance abuse. Sometimes the decision would be going to stimulants because it's the first line. So Adderall or Vyvanse, first line of treatment. If there's concerns about abuse, non-stimulants like Strattera or Wellbutrin may be a better choice. And ADHD is a little bit of a rough situation because normally you might say, hey, I will refer you out to a neurologist, that specializes in ADHD treatment. Some people don't feel comfortable with monitoring for those signs and deciphering, is this ADHD or is this anxiety or is this depressive symptoms, is this bipolar, because the symptoms may overlap, so it can be kind of difficult to determine what's happening. But I think that a thorough investigation to everything that's going on and their family history, their history, asking about how they perform in class, how they perform in school, is there any life stresses currently that's changed, what's happening, how do they take care, get things done, do they have to, how's their house, is their house very unorganized and they don't know where anything is, or is it just a mess and they know where everything is because they put it specifically where they feel comfortable with putting it. There's so many factors to it. Are they a driver that gets into a lot of car accidents because they lose focus and they're not paying attention? Those things you don't think about, but those are important too. If in fact, again, my go-to, start low and go slow. And you want to monitor for blood pressure and changes in insomnia. You want to monitor for changes in, sleep pattern or insomnia. You want to also, a stimulant can also impede your appetite, so you might feel less inclined to eat. It might worsen anxiety for some people. It might increase irritability. So those things matter. If you feel like you need a refresher on ADHD meds, a good podcast would be the Psychopharmacology Institute podcast, which covers all the latest updates. So, we want to think beyond the meds. We want to look at the whole picture. Because why? The whole picture matters. We're not just treating someone who, hey, you have something wrong with you psychologically. You're treating a human being. You're treating somebody with who may be spiritual. You're treating somebody who, you're treating mind, body, and soul, pretty much. That's how I kind of look at it. So we want to make sure that we are aware that meds are just one piece of the puzzle. And that's so important to know. Always, always, always ask about, if you ask about nothing else, always ask about sleep. Every visit, how are you sleeping? Poor sleep can worsen anxiety, can worsen depression, can also be a sign of, if they're staying up days at a time and still going, that might be a sign of mania, some mania going on there. You might want to, and that might give you a cue into what might be needed as far as adjustments and medication. Diet and exercise. Lifestyle changes can boost your mood. Some people come to me and they are very sedentary, and they report that they have low energy, low mood. They don't have the desire to do anything. They don't, and they're also, depressed because they have gained weight. And so it's important to know about their diet and exercise and education on that, how important it is, and how it releases feel-good endorphins, how sometimes it's also good to coordinate with a nutritionist, have a referral for a nutritionist if you feel like that would be beneficial to someone. And then therapy. Meds are, to me, work best when paired with therapy. And I don't think that many people would disagree with that, but for me, meds and therapy work the best. Meds can work, okay, by itself, but the therapy, it just is like the cherry on the cake to me. A big tip. Patients who understand what they're taking, why they're taking it, are more likely to stay on it. A great podcast for learning about psychopharm and practice is the Psychopharmacology Institute podcast. But again, a lot of times we start people on medications and say, hey, yeah, we tell them all the benefits. It'll help with your depression, it'll help with your anxiety, you might sleep better, you might do this, but you don't tell them the side effects that might come along with it. Like, hey, you might feel a little bit of brain fog. Hey, you might gain a little weight. Hey, you might find yourself feeling this flat affect. When you don't tell them that and they're not aware, they tend to go online and search up these things and say, hey, I'm noticing I'm having these things. It's concerning to me. What should I do? Or I stop the medication. So again, transparency is key. You want them to feel like they're a part of it, but you also want to let them know that though those are side effects that can occur, it might not necessarily occur with you. And if you wait it out, the side effects usually do subside. So it's very important to let them know that. Again, I think that I told you in the last video, maybe not. There's some common mistakes. We want to try to avoid drug interactions. Sometimes some meds work together that might cause a risk for serotonin syndrome. So please look that up, serotonin syndrome. You might be in clinical and your provider might say, what's wrong with this medication with this? You might notice that they both work with the serotonin, aspect of the brain. And you might say, oh, okay, it might increase serotonin syndrome. Is it common? It can happen, Have I found that it's been very problematic for me when prescribing? Not so much, but it is something that you need to know about and you need to be cautious about. On the other hand, individualized treatment might require you to put two meds together that might increase the risk for serotonin syndrome, and you have to just be very cautious in monitoring that member. Black box warnings, I think I talked about. Be cautious with antidepressants in young adults because it increases the risk of suicide or suicidal thoughts. Monitoring needs, so important. Lithium, you need to check the levels. Lithium, check the levels. Depakote, you want to see how their liver function is. Antipsychotics, metabolic risk. Are they gaining weight excessively in a short period of time? Are they realizing, hey, they're going to the doctor, their A1C is up? Are they feeling overwhelmed? They're feeling like, hey, I feel good, but I don't feel good physically. That's something to take into key too. If you want to, like, a resource that you can use for drug interactions include Lexicomp or drugs.com. I usually use drugs.com, and it's like an interaction checker to double check the interactions before prescribing. Again, sometimes you're looking at your books and stuff and you're like, oh my god, what do I do? What do trust your gut, use your judgment. If something is off, it is a way to go back and say, okay, let's revamp this. So don't feel like, hey, I made a mistake, oh my god, this person I just ruined it. You didn't. So to follow up, medication management does get easier with time and practice. Use your resources, ask questions, and trust yourself. Always ask questions. Who cares what people say? Just ask the question. They might know it, and that benefits you, because then you can know it as well. So don't feel embarrassed or ashamed or anything of that nature. Just ask the questions. Sometimes I don't know things, and I will tell my members, hey, I don't know this, but let me get back to you, or let me read up on this. I think that they also respect that you're not just giving them anything without knowing information either. So resources, Carlot's book, Stahl's, Kaplan's, Sadoc's Psychiatry, Hippocrates is an app that's good. Up to Date is a good app. Medscape is a good app. Online learning, Psychopharmacology Institute, the NEI Institute, Coursera, practice tools that I hear a lot of people use. I haven't used it, I haven't used it myself, but Board Vitals, PHNP question bank. So I know I kind of blabbered there, and I kind of was like tripping on my words there, but I hope that you got some benefit from this. Drop a comment below. What's one psych med that you was confused at first? Let's learn them together. Let's figure it out. We're here to grow. We're here to learn, and we're here to get better. Never feel like you can't ask a question. Never feel like you're less qualified because you don't know something, because we don't know everything. Something that someone else may know, you might pick up from them, and then you'll have that knowledge in your bank, and then you can pass it on to someone else. Like, let's look at it that way, as a growing opportunity, a growing experience. In the beginning, yes, it could be frustrating, it could be overwhelming and very scary, but you can do this. Again, we need Psych MPs just like you, there to support those that are in need. So thank you for watching. I hope that you subscribe. I hope you like the content. Again, I know I was talking fast at times. I know I kind of went off on a tangent maybe at times, but I'm here if you need any support. You take care and be well. Bye.